Hi, and welcome to this installment of Frank and Mary here in Westborough, the COVID-19 version. We have a great guest for you today. As you know, Shelby Marshall, my co-host, and I are doing these shows weekly now, so that you, as you age in place where you are, can just be dealing with the number of issues that you're facing. Shelby has found us typically great guests. We know that the fire chief is coming on a little bit later on. So Shelby, who do we have as our terrific guest today?
Okay, fantastic. Thanks, Arthur. So we have Dr. Lafarcade with us today. She's a resident of Westborough, and she's also the associate professor, associate medical director at the Cummings Veterinary Hospital. She's got lots of initials after her name, but most importantly, we want to hear from her. Good morning.
Good morning. Thank you for having me today.
Thank you so much. So I was very excited for her to be our guest today because now more than ever, I know I have 3 dogs, and there's something priceless about ending the day and my dogs providing me with some necessary therapy and relaxation and comfort. And not only are our healthcare professionals who are caring for our humans working extra hard these days and taking precautions, but our veterinarians are as well. So, Armel, thanks for being with us today. We've talked a little bit about the things we want to cover, but let's start with kind of what services what should people expect these days, right? Everyone's in a brave new world.
Yeah, I mean, I think it's a really tricky situation because, many of the supplies that we use are the same supplies that people use in human hospitals. And so we're trying to balance the need to continue to provide veterinary care with being very rational about our use of resources. And so what we're doing and what most veterinary hospitals are now doing is scaling back on their activities with several goals in mind. One is to protect the people that work at the veterinary clinics and also to protect the public from COVID-19. And we do that by lessening the density of people in the hospital. But we really do want to continue to provide care for pets. What most people are doing and what we're definitely doing is trying to provide emergency and essential care only. So what that means is that if your pet has a condition that it may be upsetting to you, but it's not really life-threatening and it can realistically wait a few weeks or a month to be addressed, that condition needs to wait. And what we're trying to take care of are the pets that really can't wait. And so it involves a little more communication with the veterinarian, maybe calling before you go in. But we're, at least at the Cummings School, we've scaled back to be what we call essential and emergency only, so that we can have as few people working in the hospital as we can to provide the most care that we can to keep everybody safe.
Okay. And so can you give some examples maybe of things that folks should wait on? I mean, you always call your vet just like you'd call your own healthcare provider if you have a condition. So what sort of recommendation and what are some of the things that might wait?
Right. So we're definitely recommending that everybody call their primary care veterinarian before heading to an emergency room with their dog first. The kinds of things that many veterinarians can squeeze in some appointments still and may make a plan for the care of your pet to be addressed later if it's not considered emergent or essential. The types of cases that we're seeing now are animals that are that have suffered some kind of trauma. So if they're hit by a car or have a wound, animals that are short of breath or that really have stopped eating, things that really can't wait. Those are the kinds of people, and some dogs have a seizure disorder, if they have seizures or collapse, shortness of breath. Really, we're talking about things where the waiting can have life-altering effects. So it's a little tricky because, what we perceive as an emergency, I mean, with our own pet, everything is an emergency. So that's where the communication piece comes in. We're trying really, really hard to still be here for the community. We recognize that people's mental health is definitely tied to the health of their pet, and it's really important to keep people well as they're socially distancing or isolating. We really, really want to stay open and do that. But to do that, we have to keep our people safe and then have procedures in place to keep everyone safe. So we tend to have a conversation first about whether they should come in, but we're really talking about collapse, shortness of breath, trauma, seizure.
Yeah.
And
that applies, I know you've mentioned dogs a couple times, but that applies really to cats as well. Cats might be more prone to get into different things than dogs or have different conditions, but it's the same general kind of conditions.
Yep. So dogs, cats, in fact, we see all sorts of unusual animals through the emergency room, and we're still seeing those now as well.
Okay. So one of the questions that I had early on, and maybe our viewers do as well, is could you pass COVID on to your pets? And vice versa, do pets get it? Could they pass it to you?
Right. So that's a really interesting question. And I think our understanding of that is evolving every day, most recently with the news of the tiger, the Bronx flu.
The tiger. Yes.
Yes. In fact, what they're not publicizing is there were really several, like 7 or 8 animals that were showing respiratory signs at the zoo. But they tested one because it involves general anesthesia to test them. So our current thought process on that is that it is very low. It's thought to be very low risk for a pet to pass the virus onto people. We know that ferrets in particular and cats can carry coronaviruses. And in some experimental studies of cats, they can pass it to each other. But there's been no evidence of being able to pass the virus to people. That being said, there's a lot we don't know about the virus still. So the precaution we are taking is we ask everybody if anybody in their house is sick, if anybody in a household is sick and their pet presents to our emergency room, we will actually wipe down the cat or the dog or the ferret or the whatever with an alcohol-soaked wipe to remove anything from the coat that might be there. And so that's the precaution. The good news about the coronavirus is it is actually pretty easy to kill with alcohol. So we tend to reduce further the likelihood that any virus could be on the fur. We do wipe down all the pets before bringing them into the hospital if they come from a household where anybody is sick. That being said, it is much more likely that a sick person can pass on a coronavirus to a cat or a ferret than it is that the animal will pass it on to the person.
And so I know that initially a lot of the precautions were, don't, kiss your dog in particular speak. You mentioned cats and ferrets, but like with dogs, don't kiss your dog, don't breathe in their face, all of that. I mean, so if someone is exhibiting any sort of, flu-like symptoms, the ones that we're well educated to at this point, what would you recommend? I mean, can you still pet your dog? Should you have a mask on if you're feeling not well, but you're not diagnosed?
So I think right now what we're saying is, we all love our pets and we want them in our household. I think for the duration of this pandemic, we could just cut back a little bit on the, close contacts with the faces. But certainly if there's somebody in a household that is sick, whether they're confirmed positive for COVID or not, anybody who's sick right now is kind of considered a possible COVID unless proven otherwise. Yeah. If a person is sick, and then ideally someone else in the household would care for the pet, and we would try to limit the interaction between the pet and the sick person for the very reason that it's more likely for us to transmit this to a pet than it is for them to transmit it to us. So a sick person should limit their interaction with a family pet, and hopefully someone else in the household can take that on. Yep. And certainly in general, we're saying to avoid close contact with the face. I mean, we actually kind of have a rule here, no snuggling with the pets, which is a very unfortunate rule for us because we love snuggling with our patients, but it's just to keep everybody safe, is to limit the close facial contact.
Sure. So you touched on this.
What a wonderful concept, being able to snuggle with your patients. That's kind of like a little Benny of being a veterinarian. That's great.
It's a perk for sure. We do enjoy it. But we're trying to be, rational about it. Certainly, just we can still give them a lot of affection, but just limit the facial interactions.
Okay.
So you had mentioned the, some of the precautions you're taking about wiping animals down.
Yeah.
So what could someone expect generally, certainly at Tufts, but, for other visiting their veterinarians, what sort of changes should someone expect, and what kind of communications are you expecting of families?
Yeah, so there's a big workflow change here in the hospital. I think at most veterinary hospitals now, if you do take your pet to see a veterinarian, it is very unlikely that you will enter the building. So you'll have a number to call. Somebody will come out, take the pet from you, and then the client will be asked to go back into the car and wait in the car. Mm-hmm. It's really hard. We do lose a lot by not having that interaction, but then the rest is done over the phone, and that is true just about everywhere now.
Yeah, right.
The other rules we've had to change in the hospital are limiting visits and things like that. So it's a little hard, I think, for the community that's used to being in touch with everything that's going on, but we're trying hard to keep that communication just over the phone.
Great. And how are you guys doing on your supplies? I mean, we hear about the healthcare crisis again in, human hospitals. How are you doing on supplies there?
Well, we're being really careful. We've actually given our ventilators to the Tufts Medical Center. So we now use sort of the 10th generation ventilator you would hope to never to need again. And we've given a bunch of supplies to the medical center. And so we're trying to, the things that people would use, we're trying to really limit the use of and finding creative ways to protect ourselves. So we're doing okay, but we're watching our supply of disinfectants and things like everybody else. And that's part of the reason we have to limit our caseload to really things that have to be seen now.
Okay, great.
So Shelby, you had suggested this guest, and it's just a really, really informative thing, because as you say, I watch it with you and your partner and your dogs, with just so many folks who've got pets, right? People are really, really worried about them, and obviously you can understand that we're all trying to chip in. Everybody's trying to triage,
but
it really shows the value of having Tufts being so close to here. That's a real.
We're trying to stay available,
That's pretty great.
Thank you so much for coming on. We know you've got a busy schedule. Thanks for all the great work you guys are doing, even with, being in an essential reduced situation, and really appreciate all the great work. Thank you.
Oh, you're very welcome. Thank you very much.
Thank you very much.
All right. Have a great day.
Thank you. Bye-bye.
Hi, folks. Welcome back to Frank and Mary in Westborough, the COVID-19 edition. We are welcoming the back half guest here today, Chief Patrick Purcell, our fire chief. Welcome.
Hi, thanks for having me.
Thank you so much for joining us. So I asked Chief Purcell to be our guest today to talk about two really important tools that we have in our community. One is CodeRED, and the other is RUOK. And the CodeRED system, I'll let him talk about it, but I think our familiarity with this system has historically been around a missing person or a particular really catastrophic event where your home phone or a mobile phone would ring with some information. And that system has been invaluable to us as a community now, including what I call our Sunday calls with the chief. So Chief Purcell, tell us about how we're using CodeRED today and how it can help us.
Sure. So CodeRED is the vendor that the town has optioned to use for an emergency alerting system. That gives us a whole host of opportunities to either notify all the citizens of an emergency or an important message, or we can isolate it to specific neighborhoods or to specific businesses versus residential. So it really is a well-designed system that tailors the needs of all of our emergency preparedness. So, for instance, the way the system works is you can either sign up for an app, which we highly encourage, and there's some benefits to getting the app. Hold on 1 second. So the app is not going to be specific to only Westborough. So let's say you go on vacation to Fort Myers, Florida, and they're using the CodeRED system, and they have a wildfire, and they need to evacuate an area. If you have the app, it's still going to notify your cellular device, and you'll know that you need to leave. So here in Westborough, we encourage people to sign up for the app. That they obviously need a smartphone to do that. And if they don't have a smartphone, we also encourage them to go onto the town's website. There's a link for CodeRED right on the front page of the website. And they can sign up with email, texting, right to your home phone. One benefit that I have as the emergency management director in the fire is whether you sign up or not, I can force a call into your primary phone at home. Problem is not a lot of people have a primary home phone anymore. So once you sign up, we try not to give calls that are not important. We don't want to dilute the system. So if you do get a call, caller ID would be represented as CodeRED, and given an opportunity to listen to it twice and then to acknowledge that. You also get a hard copy emailed to you. You also get a text and let you know that there's a message waiting for you, either in your voicemail or your email. And it's been a very powerful tool for us. It's like you said, it's helped us locate several missing people that were in crisis. We've used it on a hazardous materials incident to let neighbors know that we're operating in certain parts of town. We've let them know for winter snow advisories about parking ban issues. We need to have people get off the street to be cooperative with the Public Works Department. And now we're using it pretty heavily for CodeRED, for COVID-19. And I'd say that we're getting a lot of positive feedback now. So if you haven't signed up, you probably should. There's a lot of good information in there. And the feedback that we're getting is it's kind of a calming phone call to let people know that everything's going to be okay. And we try to put a little bit of our own philosophy behind the message to encourage people to stick together, to be good neighbors, and to take care of each other. So far, so good.
Yeah, so a couple things. One is I know our friends at Westborough TV are going to put a little icon up or an image through the segment that will give the text phone number so folks can sign up. But I'm going to attempt after the show to do a voiceover walkthrough of how someone would sign up through the app or through the website. So that will be a different segment. But, for folks that kind of need that step by step, I'm going to attempt to help them to do that. I do want to thank the chief for what I refer to as the Sunday calls. Arthur, we've been, for the past couple weeks, we've received as residents a call with Chief Purcell's voice being the narrator, if you will. And it really has been, for someone like myself who is well connected in the community and involved in lots of things, on Sunday we were making dinner as a family. The phone rang. It was the emergency number. We put it on speakerphone. Chief Purcell came across, and really kind of get tearful about it. That it was, it was an update about what was going on, and it was just this kind of calming, like, wow, there are things happening. The community is, the town is looking out for its people, and I don't know. It was a really comforting call, and that's the positive feedback Chief is speaking to that has been well received. So now there's a standard that he has to live up to.
That's a great idea. God, Chief, that's a great idea, right? Because they're going to trust you too. It's not, you're on the top of this. Right. Yeah, exactly. No solicitation. This is not a red or a blue call, right? This is all about, making people, just giving people that sense of what's really that you're looking out, people looking out for them. That's great.
I think you just hit the nail on the head. The whole premise behind us giving that message, and I'd like to think from public safety is, we have to give clear, concise, consistent information that is driven from our leader, which is the town manager, leaders, the town manager, and the board of selectmen, and that message needs to be just carried out from one spot, particularly, so that we're getting the same message out to everybody, so we don't have a breakdown in communication as word travels. If I could say one thing, I neglected to bring this up, and Shelby, you brought that up. We did make it easier to sign up for CodeRED through a texting component. The number is 99411. So it's 99411. And if you text the word Westborough Fire, one word, all one word, to that number, that'll set your device up to receive CodeRED.
I did it yesterday. It took me about 4 minutes. It was great.
Yeah. It's been a pretty good tool.
Yeah.
Is this going to be part of the tutorial at the end of the show, Shelby?
Yes, so that's part of the segment. Yeah. I'm going to try to do the app version and then do the website version. So yeah.
That's great. That's great.
I appreciate you guys highlighting this today, because the more people that sign up, we get a better bang for our buck, and we get better communication. So it's really a great tool.
Yeah, excellent, excellent. So let's shift gears a little bit and talk about a system that's been in place for a while, but hasn't had quite the sizzle effect we had hoped for.
Sure.
It's called RUOK. When you were a guest on Frank and Mary a while ago, we talked about it. And maybe this is one of those positives that comes out of this whole pandemic, that this system is one that ultimately will be better utilized. So tell us about what RUOK is.
Sure. So RUOK is a software that was purchased by the fire department through a grant and through gift monies that we installed. It has a service that we make available to any resident if they want an automated system to call them once per day and check on their welfare. It was originally geared towards the dementia-friendly project. It is pretty specific to senior citizens, where they can request a phone call to be driven. We usually do them in the morning, and when the call is made, if they answer, they just hit a number key on their phone to acknowledge the call. If they don't, the system will recall them a short time later. And on the second time, if they don't answer, we would send a fire truck to their house, no lights or sirens, just to make sure that they are actually okay. And if they're not, we have the tools to get into people's homes without breaking anything, hopefully. And sometimes people could be on the floor and just fallen, might need help up. But where I think this is particularly important is we're in a pandemic. People are getting sick, and oftentimes they get sick pretty quickly, and sometimes they can't get to a phone. So I think having a system in place that can call and check on people is pretty important right now. I think citizens in town are doing a really good job to try to check on their neighbors, but there's a lot of people that live here, and I just think that having a system in place to make those calls daily, it just improves our safety level.
Chief, how does someone sign up? I mean, again, this is another one of those voiceovers I'm going to try to do with the help of my friends at Westborough TV. How do you sign up for RUOK?
So they can email myself or the deputy fire chief. Our email address is on our website, or they can call direct to the administration division here, which is 508-389-2310. Sorry.
That's okay.
508-389-2310. And either the Deputy Fursky or Lieutenant Patrick Cullen can help and get them set up. And it's really pretty simple. And there's other components of that system that we offer too. We would steer people towards the senior center to get a secure key box. Fire department is the only person that has a key to that secure key box. You can put a home key inside, so we don't have to pick a lock or maybe spread a door jam to get a door open. So we can access your home, and we have a whole protective system in place to maintain integrity of that key, so nobody else can get the key. And the last thing we also do as part of that system is, and you don't have to do this part, we try to take a picture of the occupants of the house, so that should they have Alzheimer's or dementia, we would put that as part of our site file attached to an address. So if a person did go missing, we can distribute that photograph on all fire trucks, ambulances, police cars on their mobile data terminals, and also distribute that photograph on CodeRED. So now, instead of having 4 or 5 sets of eyes out looking for a missing person, we could have our whole town keeping eyes out for missing people. It's a pretty powerful tool.
Yeah,
as you know, Shelby, I do this in a lot of communities. That's one of the most comprehensive programs I know of in any community to really help folks who maybe have some memory problems, but to help their caregivers to make sure they're safe. So the notion that, through this crisis, people are just becoming more aware of this. It's a really positive thing.
Yep, absolutely. We're gonna get some people signed up, Chief. I think this tool is invaluable. I know that we in my home, where my mother-in-law lives downstairs, have taken advantage of adding that lockbox, and it has saved the door many times when your team has had to come out. I'm not trying to share HIPAA information, but it really has. And we have not been in town at the time, and your team has that secure key. I've never worried about anyone else having access to it. And they've gone in, and in some cases, additional assistance was needed, and it would have been, it would have been a costly front door, possibly, if not. So, although one time they smartly removed the air conditioner, that was the little guy had to climb in the window. So.
So Shelby, once again, these are just great guests that you're bringing on. And Chief, thanks so much for being willing to do this, right? And hopefully, the whole point of this show, and I know that we've talked to the folks at Westborough Cable about this. One of the hidden benefits or results of this whole pandemic is that people are becoming more aware of the tremendous value that community cable can provide by giving you and like people like Shelby this forum to be able to reach out to a lot of folks who otherwise might not be tuned into some of this. So thanks a million. Shelby, thanks for being willing to do this. This is a wonderful show.
Chief, thank you for all that you guys continue to do to put yourself in direct harm's way to serve the community.
You're welcome.
Thank you. Thank you both. Thank you once again, Shelby. Thanks to the folks at Westborough Cable. And we'll see you again probably next week with the next installment of Frank and Mary in Westborough, the COVID-19 version. Thank you.
Great. Thanks, everyone. Have a great day.